Good morning, kids. This is Grandma Freeman, and today I want to talk about something that's important to me. It's a study that I do when I have the time, and that's a study of nutrition and vitamin. And one of the things I use, first of all, I want to make sure that you understand I'm giving the credit to Dr. Mindell, and he is the author of the Anti-Aging Bible and also the Vitamin Bible. And so this is not my mind, it's his study, and he has done extensive research on both of these books, and he has other books that I'm aiming to get. And I would like to replace my Vitamin Bible because it's it's old and it's falling apart. So I do, and I have also typed up some of this important information in notes, and I have that in a binder. But today I'm going to use the notes that I have written, and the topic that I'm talking about today is osteoporosis. And this is an affliction that I suffer with, and many older women and even men suffer with osteoporosis. And it's a bone disease where it's a thinning of the bones and a weakening of the bones to where older people can have breaks very easily. And also it can affect future generations, as some women who are older and have the beginning of or have osteoporosis may get pregnant and have a child that with weak bones, and this is a hereditary thing that also. But anyhow, so giving credit to Dr. Mindell, I took some notes, and I'm going to talk about different supplements or vitamins and minerals that will help, that you can help to strengthen your bones and even grow stronger bones by following some of these vitamin regimens. Okay, the first mineral that's very important for maintaining strong bones and healthy teeth is calcium. Calcium does that, and it keeps your heart beating regularly also, and alleviates insomnia, helps to metabolize your body's iron, and aids in nervous system, especially in impulse transmission. The best natural sources, bear with me, this is a little difficult, I'm reading it. The best natural sources are milk and milk products, all cheeses, soybeans, sardines, salmon, peanuts, walnuts, sunflower seeds, dried beans. Beans are very important, especially for vegetarians, and green vegetables. And the deficiency disease, that means deficiency is that you're not getting enough, or maybe sometimes none, are rickets, osteomalacia, and osteoporosis. Supplements, most often available in 100 to 500 milligrams tablets. Bone meal is a fairly common supplement. The best form is chelated calcium tablets. Many good multivitamins and mineral preparations include calcium. Doses most often used are 800 to 2,000 milligrams per day. Okay, I am taking a supplement now, and this has a lot of the B vitamin complex, and that's also, and calcium as well. So that's very important to me, and when this is done, I'm going to try another vitamin regimen. And also I'm taking, because I'm low in vitamin D3, I'm taking a supplement. Now, the daily recommended amount is 1,000 milligrams. Well, this is 1,000, plus it's in my Centrum multivitamin, so I'm taking 2,000 because I have a vitamin D deficiency. And really, you shouldn't be taking more than 1,000, but the doctor wants me to take at least 2,000. Okay, and I'm also taking this for my heart. This is CoQ10. I'm taking 100 milligrams daily. I'm trying to remember to take it. And, life gets busy, and sometimes I'm away from home, and sometimes I even eat out once in a while. I try to eat at home because I want to know what I'm eating. So that's my regimen right now. And I'm going to finish the Centrum, and then I'm going to try something else, because I also have high cholesterol, and that means that I have my LDL is high, my HDL is also good, and that's important. That's why I don't take any other medication for it now, because my HDL is up, as I'm trying to keep that up at a higher level. Okay, so the calcium is important for me, and I wasn't getting enough of it. Okay, there is another type of calcium, and this is called calcium pantothenate, and it's a pantothenic acid, a panthenol, and it's the vitamin B5 complex, vitamin B5. Okay, this aids in wound healing, fights infection by building antibiotics, treats post-operative shock, prevents fatigue, reduces adverse and toxic effects of many antibiotics. Okay, and the best natural sources: meat, whole grains, wheat germ, bran, and that would be wheat bran or maybe oatmeal bran, and then kidney, liver, and heart. And you find those in luncheon meats and wieners. And then green vegetables, brewer's yeast, nuts, chicken, and crude molasses. The deficiency disease is hyperglycemic, duodenal ulcers, blood and skin disorders. And I suffer with eczema. So this is very important for me to try to improve my health and to combat my afflictions and diseases. Okay, vitamin D is okay. It's called the sunshine vitamin. I'm not going to read these other words because I know I'm going to mess up on those. Okay, now I'm just, this is a study. I'm not a professional. I'm not a teacher. I'm not, but I do have an understanding of medicine and how it works a little bit, and of diseases. And I wanted to be a doctor when I was a child, but finances and brain power and memory, just wouldn't allow that. Okay, vitamin D is essential to help the body utilize calcium and phosphorus. So it goes together. A lot of vitamins and minerals go together. So it's important to have a well-balanced diet. And what it can do for you is properly utilize calcium and phosphorus necessary for strong bones and teeth. Taken with vitamins A and C, it can aid in preventing colds. That's important to know. Help in treatment of conjunctivitis. Aid in assimilating vitamin A. And vitamin A is very, very important also. Okay, natural best sources: fish liver oils, sardines, herring, salmon, tuna, milk, and dairy products. I want to say one thing. My mother told me not to mix fish and dairy or milk together, not to eat them at the same meal. So I try to follow her advice, because some people can't take, the chemical reactions of those two mixed together. Okay, the deficiency vitamin is rickets, severe tooth decay, and osteomalacia, senile osteoporosis. The supplements daily doses often taken are 400 to 1,000 milligrams. Okay, phosphorus. This is very important. Goes with the vitamin D. Vitamin D and calcium are essential to proper phosphorus functioning. Phosphorus is necessary for normal bone and tooth structure. Niacin cannot be assimilated without phosphorus. Phosphorus is important for heart regularity and essential for normal kidney function. Plus, it is necessary for the transference of nerve impulses. What it can do for you: aid in growth and body repair, provide energy and vigor by helping to metabolization of fats and starches, lessen the pain of arthritis, promote healthy gums and teeth. Best natural resources or sources: fish, liver, meat, whole grains, eggs, nuts, and seeds. Now, I was told not to eat seeds, but if you grind them up and put them in your food, that's okay. It's just the taking them in the whole form is not what my doctor wanted me to do. Okay. Deficiency disease, rickets, and pyorrhea. Now, pyorrhea is a disease of the gums, and people often, develop that, especially older people when they're so busy, they don't, it just happens. And they get it. It's a gum disease, and it causes tooth loss. So that's one thing. So phosphorus is very important. Okay, excuse me. Magnesium, necessary for calcium and vitamin C metabolism, as well as that of phosphorus, sodium, and potassium. Magnesium is essential for effective nerve and muscle functioning. Also important for converting blood sugar into energy. And magnesium is known as the anti-stress mineral. Aids in fighting depression, promotes healthier cardiovascular system, and help prevent heart attacks. So magnesium is very important. And keeps teeth healthier, helps to prevent calcium deposits, kidney and gallstones, brings relief from indigestion. The best natural sources of magnesium are figs, lemons, grapefruit, yellow corn, almonds, nuts, seeds, and dark green vegetables, and apples. Apple a day. Okay, deficiency disease, tremors. The supplement is 500 milligrams of magnesium divided over 3 meals. And then here's another one. This is minadione. It's vitamin K. I'm not sure I pronounced that correctly, but it's vitamin K. Vitamin K may play in helping to prevent osteoporosis. Vitamin K is formed by natural bacteria in the intestines. It is also found in leafy green vegetables, alfalfa, egg yolk, safflower oil, soybean oil, kelp, which is seaweed, and fish liver oils. Possible benefits: studies have shown that vitamin K supplements may help reduce the loss of calcium in urine, which contributes to the thinning of bones. I didn't know that. Previous studies have linked a low level of vitamin K to an increased risk of fractures. The RDA, that's recommended daily allowance for vitamin K, is 100 to 250 mcg daily. The recommended supplement is 50 to 100 mcg daily. Do not exceed 500 mcg daily. You don't want to over vitamin K yourself. Okay, boron. This is a trace mineral. The body only needs a tiny quantity of boron, However, it may play a big role in helping to prevent osteoporosis and may help your brain to work better. Boron is found in most fruits and vegetables. That's good to know. However, dried fruits, prunes, apricots are the best sources. Another good source of boron are grapes and also raisins. Research found that boron supplements reduce the loss of calcium and magnesium in urine, both of which are minerals that are needed to help build strong bones. Take 3 milligrams daily. Boron supplements in the form of sodium borate. Boron works better if taken in a good vitamin and mineral supplement, including calcium, magnesium, manganese, and riboflavin. Riboflavin is one of the B complex. Okay, here's something that I think that I'm affected by. This is called hypoglycemia, and I reference this from the Vitamin Bible written by Earl Mindell. Okay, and okay, this is what I learned and is important to me for my better health and my understanding of what this condition entails. It is a condition of low blood sugar, and like diabetes, presents a situation where the body is unable to metabolize carbohydrates normally. Since a glycemic system overreacts to sugar, producing too much insulin, the key to raising blood sugar levels is not by eating rapidly metabolized carbohydrates, but by eating more protein. And that's on page 241 of the Earl Mindell's Vitamin Bible. Sugar is also the villain where hypoglycemic, let me say that again. Sugar is also the villain where hypoglycemia is concerned, and though there have been arguments pro and con, directly or indirectly, a factor in diabetes and heart disease. So I kind of think, and that's on page 285, by the way, of the Vitamin Bible. And I kind of think what they're saying with hypoglycemia is like a precursor to diabetes. And that does run in my family. My mother had diabetes, and both my sisters have diabetes. And it doesn't show up in my tests, but I think I am hyperglycemic. But anyway, let me go on with this. Hyperglycemics could use more calcium. So I wasn't drinking milk. I do like yogurt, and I do get that very often, but I don't do it always on a daily basis because I run out all the time. And but anyhow, that part about using more calcium is on page 94 of the Vitamin Bible. So that's important. I really do think that's my problem. Another one of my problems. I am the type of person that likes to study, and I like self-help books. And to me, Dr. Mindell's books are self-help books. So, and I have in my lifetime have had to help myself due to circumstances, beyond my control. But I try to. And I'm kind of I don't know if you call me a nerd, but I like to read and study things that are important to me. And nutrition and food, cooking, it's all important to me. This matters. And I know there are many people that are even better at this than I am. And, well, anyhow. Okay, and then there's some more that I go on that have to do with my other affliction or disease is eczema. So, and I've already gone through that in another video. So I hope this helps you, and if you have an opportunity, I would recommend buying either the Vitamin Bible by Dr. Earl Mindell or any of his other books that might help you. He's a pharmacist, and he really is good at writing and explaining all this so that we can understand it. Well, I hope this is helpful to you. Please like and subscribe. Sorry, I'm getting confused again. Please like and subscribe. Bye now.